So TB is a bacterial infection that is caused by Mycobacterium tuberculosis. Um, on a scale of 100, let's say maybe 75%, almost everyone has encountered someone with TB. But TB is dangerous. So what usually happens if someone has got TB, or you've inhaled TB and you've got a strong immune system, what will happen is you will inhale it, it will enter into your lungs. Once it enters into your lungs, through the process of phagocytosis, you'll find that once it's been engulfed, it becomes powerless and it becomes dormant. And once your immune system, and when it becomes dormant, it forms what they say a granuloma. So a granuloma will be just there, depending on the site where it has been trapped by the macrophages. And when your immune system is suppressed, that's when now it tends now to change, and then it affects you. So it could be maybe due to age, or maybe you've got a chronic condition, or maybe you have an immune suppressed condition like HIV. That's the reason why they tend to say that it's an opportunistic infection. It takes advantage if the immune system is low. On the other hand, me personally, I consider TB to be as a chronic pneumonia, because the damage is the same with pneumonia, and the management of TB is different, but you use antibiotics. There are signs and symptoms that someone tends to have when they have TB is that they'll have a chronic cough which is productive for more than 2 weeks, experiencing night sweats, weight loss, and pretty much that, but mostly night sweats, weight loss, and a chronic cough for more than 2 weeks. If someone presents with that, I strongly advise you first do a sputum test and a gene expert accompanied by a chest x-ray. On the management, depending with the results, put the patient on isoniazid, ethambutol, rifampicin, and pyrazinamide. Patients who tend not to finish the TB drugs, they tend to have resistance once the TB is back. That's where now TB is hard to control. TB is curable, it's not manageable, it's curable. But when you fail to complete the course, the bacteria has got the ability to develop resistance to the same drugs. So once you develop resistance to the TB drugs, now that's where now TB become vigorous and it's easily transmitted to other people. So that's all about TB.